Now we'll talk about quite another very common syndrome that could actually get to affect the gastrointestinal system, and this is what is known as a Lynch syndrome. Okay, now even if you won't understand anything in this lecture, I want you to go with this. Can you see that Lynch syndrome has another name which is known as the hereditary non-polyposis colorectal cancer? Okay, so non-polyposis, well, let's talk about it. So it's an inherited condition that greatly increases the risk of colorectal cancer. Okay, it is caused by mutation in a gene known as what? The MMR gene. Okay, and it can be inherited. We'll address that word non-polyposis soon. Okay, so it's actually one of the most common type of disease condition that could actually lead to colorectal cancer. It's caused by what? Mutations in what? Repair genes. Okay, so different repair genes. Okay, you can just collectively call them the mismatch repair genes. That's the MMR genes. So inheritance is autosomal dominant, meaning a child has 50% chance of inheriting the condition, even if it's just one of the parents that is affected. So people with Lynch syndrome are more likely to develop cancer at a younger age, even before the age of 50. So different cancers, they can develop different cancers. So because colorectal cancer is common, if it's a girl, endometrial cancer, ovarian cancer, stomach cancer, small intestine cancers, urinary tract cancers, biliary tract cancers, pancreatic cancers, prostate cancers, brain cancers, skin cancers, a lot of risk. Okay, so diagnosis, you see that multiple relatives are having it, and you can also do genetic testing to actually confirm that there is mutations in the mismatch genes. Okay, then treatment, colonoscopy, just keep checking the person and also check other family members. All right, then you also address the treatment based on the type of cancer that the person actually develops. Okay, so preventive surgeries is some women, they can just remove their uterus just to prevent cancers coming up, probably after they have given birth to the number of children they want, or they remove the ovaries. Okay, then also chemotherapy. Okay, so that's what we have. Well, what is known as a polyposis that I was trying to address, it simply is non-polyposis, right? That's to tell you that there's colon cancer, or there will be cancer without polyps. I don't know if you understand. So that's what actually differentiates Lynch syndrome from other syndromes that usually come up with polyps.